And welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look. Whether you've had children, are aging, or live an active lifestyle, doctors say your pelvic floor muscles are essential to your overall well-being.
Your pelvic floor is basically just a group of muscles at the floor of your pelvis, hence the name. So that's the red on this model. It's going to run all the way from the front at the pubic bone to the back at the tailbone, and then around to the hips on the sides as well.
Bon Secours physical therapist Julia Skelton explains the pelvic floor is a group of muscles that supports the bladder, bowel, and in women, the uterus. But women aren't the only ones who can experience changes.
Men can be affected similarly as women. They have obviously different anatomy, so that can present a little bit differently, but they can still experience urinary or fecal incontinence. They can experience constipation, pelvic pain.
Doctors say pelvic floor dysfunction can be triggered by prostate surgery, pregnancy, childbirth, or even lifestyle factors like chronic constipation or heavy lifting.
What we'll see clinically is going to be some type of leakage, so bowel or bladder leakage of some kind, urinary retention or an inability to empty the bladder, constipation, pelvic pain, and pelvic organ prolapse as well.
That's where therapy comes in.
So I think oftentimes the narrative out there for the public is just do your Kegels, which hopefully that's changing a little bit. Kegels have a place, but they are not applicable for everybody. They're not a one-size-fits-all kind of exercise. And so for just general advice, weakness is not maybe always the issue.
Skelton says trained professionals can help you determine what your body needs.
So you need that full range of motion, just like you would need your bicep to be able to flex and extend your arm for a full functional use of your arm. You want your pelvic floor to be able to engage and relax fully as well.
According to medical professionals, physical therapy is also useful during pregnancy and helpful in postpartum recovery.
We're taking you through some mobility exercises, through manual therapy techniques, working on your tolerance to activity, just making sure that you can be as functional as possible with as little pain as possible.
Doctors say you shouldn't be embarrassed about pelvic floor issues. Getting help can make all the difference. For this week's Ask the Expert, I'm Kelsey O'Donnell. With more than 1,500 mobile health clinics nationwide, researchers with the National Institutes of Health say over 5 million people are utilizing their care. That includes hundreds of people in our very own backyard.
We actually go across Greenville County and outside of Greenville County, and we're now at 36 different site locations. We go to churches, we go to government organizations, and other community organizations within our community.
Like many hospital systems, Bon Secours' team of healthcare professionals offers more than just in-office care. They're on the road, expanding available access.
Mobile healthcare is essentially primary care on wheels. We offer a variety of services from preventative care to acute care like sore throats, earaches, UTI, as well as chronic conditions like diabetes and high blood pressure.
Experts from the National Institutes of Health say the clinics provide an efficient way to deliver medical services to at-risk populations and, in many cases, provide care to those who may not be able to afford it.
One of the special things we offer is providing accessibility. So we are able to bring healthcare to our most underserved communities. We're also able to provide preventative healthcare, so helping our patients address those chronic healthcare conditions and address the healthcare needs that they might not otherwise get treated if they don't have a healthcare or a primary care home.
All you have to do is walk in. Organizers say there's no need for an appointment. And if you're concerned about payments,
we do not turn anyone away.
Hogue tells us they'll work with you to assure you get the care that you need, as they accept most insurances, including HMOs and Medicaid.
We're hoping to bridge the gap between access to healthcare and our community. So we're helping to provide healthcare to our underserved population, as well as address those social determinant of health needs such as food insecurity, homelessness, economic stability. We're hoping to bridge the gap.
For this week's Ask the Expert, I'm Kelsey O'Donnell. According to doctors, ADHD is a neurodevelopmental condition.
That stands for attention deficit hyperactivity disorder that affects both children and adults.
That's Justin Plant, behavioral health therapist at Bon Secours St. Francis.
Someone is born with a predisposition to ADHD based on genetics and brain development.
Plant says symptoms can include inattentiveness, hyperactivity, or both.
Like most people in therapy will say, they find themselves going from one task to the next without really completing any task fully. And may also be accompanied with a lot of forgetfulness. For some, symptoms can eventually improve. A lot of times adults, when there are kids who are hyperactive with ADHD in school, they may outgrow some of those behaviors, but usually those inattentive symptoms of concentration and focus persist. Plant says having a routine can be helpful. He also suggests parent training. How to provide prompts, how to create an environment that focuses on structure and routine that helps manage those symptoms. Medication may be required to treat some symptoms, but Plant says it's important to watch out for any negative side effects. Sometimes stimulants make it hard to fall asleep or stay asleep. Appetite suppression can also happen, as well as any changes to your child's mental health. Plant says things like anxiety and depression can often be a byproduct of having ADHD. For kids in school, that maybe struggle with academia because of ADHD, or they're often in trouble for hyperactive presentation, can result in issues with, affecting their self-esteem and self-worth. And regardless of how one decides to treat their ADHD symptoms, Plant says it's important to remember this. Just because we have ADHD and those areas may be difficult, it has nothing to do with any individual's lack of intelligence. If you suspect your child or you may have ADHD, ask your doctor to be tested. Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Experts section. Right now, we're going to take a quick break and return with answers to more of your medical questions. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis.
A balanced diet is not only important for adults, but for children too.
There are essential nutrients that all humans need.
Dietitian Debbie Milne says our bodies cannot produce essential nutrients, so they must be obtained through food.
Nutrients such as protein or calcium and vitamin D. The micronutrients like vitamin A and E are super important for the immune system.
Milne says eating the right foods is critical to healthy development.
As children go through their growth spurts and up through their teen years, they're going to develop their bone strength and bone density. And calcium and again vitamin D are very critical for that.
It's important to make smart choices on which foods and drinks you put in front of your child.
We serving the child milk with their meals if the child tolerates it versus something like sweetened sodas or even juice.
Fiber is a nutrient that is often overlooked, but Milne says it's vital for the immune system and gut health.
At least 14 and up to 30 grams a day as they go through the teen years.
It's also a good idea to make sure your child consumes omega-3 fats for brain development,
which could be found in fatty fish like it could be salmon or mackerel or trout.
Milne says whole foods are best at mealtime, and when it comes to snack time,
the best snacks options for children and for adults is to combine like a carbohydrate source with a protein source. The carbohydrate will pick the brain up and energy levels up, and the protein source helps stabilize blood sugars.
If your child is a picky eater and you are struggling to get them to eat fruits and vegetables, Milne says be persistent.
It can take 10 to 20 times of a child who's never had a food before to learn to say, you know what, I'm familiar with this, and not only familiar, I actually like it now. Try to cook it different ways, just don't give up.
And if you're still striking out, reach out to your child's pediatrician.
So this is a good discussion for the pediatrician. He or she may recommend vitamin supplementation at early ages.
For this week's Ask the Expert, I'm Taylor Murray.
Screenings and care happen year-round.
I think it's most important to just learn your own breast during a physical exam and assess for changes, because that might be the first presentation of a breast cancer.
Dr. Jennifer Cranny has studied breast imaging for more than 2 decades, and in her years of experience, she's seen the time frame fluctuate on when to start screenings. Some health recommendations say you should begin routine mammograms at the age of 50.
A mammogram is an imaging study that uses x-rays to look at the breast tissue with exquisite detail.
But in recent years, that time frame has dropped to women in their 40s and in some cases even younger.
I am seeing younger people, younger women presenting with problems and breast cancers in their 30s. Really, in the last 5 years, this has increased tremendously.
It's not a one-time exam. Doctors recommend you see your physician annually so they can track any changes. You can also stay ahead of the curve by completing at-home screenings. Oftentimes, it's a way to detect breast cancer or other issues earlier.
The best at-home tool is clinical exam. Know your breasts and always look for changes.
Here's what to look for.
So when a woman is doing a self-exam, again, you learn your own breast, and when you might palpate your breasts in the shower or while you're lying down, and most of the time you're looking for a lump or a mass or just an area of thickening, any changes from what you're used to.
If you notice a change, medical professionals say you should talk to your doctor and schedule more in-depth imaging.
It is important to see the mammogram year to year and assess for changes.
Because if you ignore changes in your breast over time, doctors say you could be delaying the detection of a more serious issue. For this week's Ask the Expert, I'm Kelsey O'Donnell. According to the American Cancer Society, there are more than 100 types of cancers, and doctors say the ages of those being diagnosed is changing.
Anybody can get cancer. It's more common as we get older because part of getting older is the DNA starts to become less stable as it divides.
Traditionally, Dr. Kevin Kohler says he sees more cancer patients in older generations, but in more recent years, those coming in for treatment are younger.
We're seeing more and more younger people being diagnosed with aggressive cancers that weren't necessarily observed, in a couple generations before. We're assuming that a lot of that has to do with our diets.
Improper diet and unhealthy lifestyles, Kohler says, are having a negative impact on many people.
It's your environment. So it's your diet, it's how do you move physically. Like we know that sedentary lifestyle, obesity, both of those also play a role with developing cancers, specific types of cancers even. So it always comes back to the same simple advice of eat a healthy diet and move, and that's just difficult to execute in our modern lifestyles.
But thanks to advancements in technology and improved screening methods, early detection is playing a key role in helping doctors identify and treat cancer earlier.
In the last 15 years, 20 years, we've made a lot of progress in targeted therapies, so having therapies that are specific to a mutation that may be present in the cancer, and then also immunotherapies, which are non-chemotherapies.
Doctors say the type of treatment and screening you may receive can be based on factors like age and gender.
So I would say there's routine screening guidelines for most people as we kind of cross certain thresholds of age. So for example, women getting mammograms at age 40 if they're average risk. That changes if you have a family history of breast cancer, where then you might go say age 30 or 35.
For many, the thought of having cancer can be overwhelming, but taking proactive steps to prioritize your health can make a big difference. Not everyone requires an oncologist right away, so consulting with your primary care doctors can be a good first step, especially if you have a family history of cancer.
I think the main thing is that just people, they're aware of their own family history and that they're transparent with that with their family physician, that they're getting the regular screenings. Because again, there's only a handful of cancers that we can actually screen for, and that those screenings do save lives. That's why they're there for us.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert.
It has been several decades since a new class of antibiotics hit the market, but Findings published in a medical journal in March showcase a breakthrough discovery that could add another antibiotic to the lineup. Only time will tell. Dr. Ryan Paulson, a family medicine physician at Bon Secours St. Francis, says antibiotics are key to fighting bacterial infections.
Antibiotics are prescribed when your clinician believes that you would benefit and that there is a high likelihood that an infection is caused by a bacteria, in which case the antibiotic can be helpful to neutralize that infection.
There are several common illnesses that antibiotics are regularly prescribed to treat.
Things such as urinary tract infections, pneumonia if caused by bacteria, sinus infections are a common complaint. Those are general examples when antibiotics may be utilized.
Dr. Paulson says depending on the infection, some people will be prescribed antibiotics for as little as 3 days, others for several months.
Classically, if you are presenting to a physician like me in the outpatient setting, we may anticipate antibiotic durations up to 2 weeks in duration.
Like any medication, there can be side effects.
Common side effects of antibiotics can include GI complaints such as abdominal cramping, diarrhea, but they can become more complicated than that.
Once you start an antibiotic treatment, Dr. Paulson says it's important to complete the entire dose and duration as prescribed. And don't stop it abruptly just because you start to feel better.
Because that could essentially lead to a reemergence of an infection that could have potentially been completely resolved, then also leading to necessity of alternative therapies and down the line. So it is important to complete those antibiotic durations as prescribed.
Antibiotics are not addictive, but overuse can lead to antibiotic resistance, which Dr. Paulson says could be a problem.
A concern for us down the road would be that things that are resolved by certain antibiotics are no longer going to be able to be treated by these, and that's why we have to be very mindful of this.
Dr. Paulson says when talking to your doctor about an antibiotic, make sure they know what other medications you are taking and if you have any allergies before they prescribe one. For this week's Ask the Expert, I'm Taylor Murray.
About 1 in 8 women will be diagnosed with breast cancer in their lifetime.
You have cancer. It's a phrase most don't want to hear, and in recent years, health experts say it's become more common.
It's a very common misconception that all breast cancers are hereditary. In fact, the majority of breast cancers we see are not inherited. Most of them actually are what we call sporadic, so they come up randomly in patients who maybe don't have a family history.
Well, doctors say the majority are not hereditary. They do see a number of breast cancer cases that are based on genetics.
There are actually several genes that can predispose women to breast cancer. We actually check in our clinic a panel of dozens of different genes looking for inherited predisposition to breast cancer.
Having a specific genealogy does not mean you're guaranteed to have cancer, according to doctors. They say it helps them predetermine a plan for testing or explore treatment options if cancer is found.
The main tests that we would do are what we call germline genetic testing. That's a test that we would do either of the blood or even of the saliva. We can do a cheek swab for DNA to look for genetic mutations that patients were born with.
If results return positive, doctors will then take a proactive approach, putting a plan in place.
So for a patient with breast cancer, the first step is to treat their breast cancer. We may use surgery, we may use chemotherapy or radiation therapy. But then we're going to take some steps to lower their risk of developing subsequent breast cancers.
Whether breast cancer runs in your family or not, medical experts say it's important to stay up to date on screenings and make sure you perform self-breast exams.
I think the most important thing in terms of inherited breast cancer is for women to know that the vast majority of breast cancers we see are not inherited. So just because you don't have a family history of breast cancer doesn't mean you should ignore something abnormal that you felt or that your physician has found.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
There are several types of blood clots, but the most common, according to the CDC, is deep vein thrombosis, or DVT. Dr. Michael Ludkowski, an interventional radiologist, says how a clot affects the body depends on the type and location of the clot.
Blood clots can form in any blood vessel anywhere in the body.
When the blood clot forms in a deep vein of the leg, pelvis, and sometimes arm, that's deep vein thrombosis. This type of clot does not cause heart attack or stroke like an arterial thrombosis, which is a clot that blocks an artery, but it can still be life-threatening, leading to something else.
DVTs can also lead to PE. A PE stands for pulmonary embolism. When a blood clot in the vein in your leg breaks loose, passes up through your heart, and gets pumped out to the arteries in your lungs.
Dr. Lekowski says it's important to recognize the signs of deep vein thrombosis.
The most common symptom is for acute onset or relatively rapid onset of leg swelling and discomfort. Sometimes that discomfort starts in the calf, sometimes it's in the thigh.
The risk for this type of clot goes up if you've recently recovered from an injury, illness, or surgery, or if you've recently gone on a long trip, so keep that in mind. And if this clot ends up traveling to your lungs, you may notice a cough, chest pain, and this symptom.
It most commonly causes shortness of breath. Shortness of breath that gets worse when you are active.
Dr. Lekowski says the best way to reduce your risk of developing a blood clot is avoiding a sedentary lifestyle.
Move. You have to get up and move. You have to use your muscles to squeeze the veins to pump the blood.
But if you do find yourself experiencing symptoms of a blood clot, don't hesitate, seek medical attention.
If you have unilateral, one leg versus the other swells up in a short period of time, a matter of hours or a few days, you should absolutely seek medical consultation because that is the #1 symptom of a lower extremity DVT.
Dr. Lekowski says most procedures to remove a deep vein blood clot take between 35 to 95 minutes, and most patients go home in under 48 hours. For this week's Ask the Expert, I'm Taylor Murray.
That's a wrap on this week's Ask the Expert show here on WSPA Plus. Join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thank you for making an appointment with us today.